the concern came up with a doctor in New Jersey who gave expired vaccinations to his patients.
Oh, wait a minute.
This crosses two thresholds.
Okay, so there's a doctor in Jersey, which you read an article, I think it was in the Asbury Park Press, and it made a couple of newspapers locally, and it made Channel 2 News and a few other. He got access, according to the reporter, to vaccines that should have been thrown away. That's what the appearance is.
That's right.
1,000 patients were involved. The dollar value could be as much as $500,000 to $1 million. Now, first of all, people don't realize these vaccines are very expensive. A practice of 2,500 kids over your lifetime, you might have to outlay to buy the present cost of vaccines somewhere between $2.5 to $3.5 million to pay wholesale for vaccines. There's great incentive to make money today if someone wanted to do it by maybe just give sugar and water.
Right.
Okay, but this is a doctor willing, got outdated vaccines. He probably said, they're probably still good in his mind. He even brought a gun to his office, fired it, according to this. He was drunk on several occasions. And it took the state of New Jersey, Department of Health, and Ocean County, 9 years to pick up. There had to be some question marks.
Well, the question marks that were answered by two people that worked for him that were witnesses to his behavior in the office. This was one item. And as I mentioned before, the vaccination business crosses over two thresholds. Number one was his professionalism. When the
lack of his patients' records were being incompletely kept, or he had a reason for that. Can't prove what he did.
That's right. That was one thing. The other threshold was greed.
So, if we could take the cost of vaccines, a profit on vaccines, away from doctors who give vaccines, would reduce the chance of situations like this happening. So, one great suggestion, some states are actually doing, they get the vaccines for all the pediatricians or the primary care physicians. They give it to the doctor for free. He reports it to the insurance carrier. He reports it to the Department of Health. Once he has used up a certain number of a particular vaccine, he's shipped replacement. He might get a small administration fee because there's a lot of work on vaccines. But there's no incentive to use outdated.
Right. The cost is not out of his pocket. The profit is not in his pocket. He's getting a small administration fee for administering the medication. He doesn't have to worry and be concerned with his records, whether they're fresh or whether they're outdated. All the doctor has to do is maintain viable records.
And most pediatricians are now buying less in terms of quantity per vaccine, trying to get less dollars shipped out, because you may not get paid for a month or two or longer. Some of the units are paying some of the doctors 18 months later. And these are very expensive. So you keep a small quantity, you reorder when you need it, because you're finding you have to keep yourself lean and mean, because you can have $100,000 in vaccine in a refrigerator making no money. You're not getting any reimbursement for it unless you use it. So you take that away, then doctors could store it without fear of having a big overhead of storage, little incentive, and you could be audited that you have good immunization rates, and doctors who meet a higher rate could get a little incentive for doing the best care. Because it's been shown, if you vaccinate enough of the children, less of diseases are prevalent. And like this little thing in San Diego, if the vaccine rates were considered high enough, then the threat of someone coming from another country, Mexico, someplace, bringing in measles would be minimized.
Right.